there's definitely a myth out there that heroin and opiate abuse happens somewhere else and in someone else's family. You've heard firsthand from Patty about her son, and I think many parents still believe that it could never happen to your child. I, as a mother, would say it could never happen to my son. I know as a father would say it could never happen to my daughter. But it can. And since we started this package of bills, in Bergen County alone, there were 28 heroin and opiate overdoses in 2013, 28. And in the first 6 months of 2014, 24 people have overdosed. And I come from Bergen County, and you would think it's a county full of resources and education and awareness, but 27% of Bergen County residents admitted to substance abuse programs were there because of heroin, opiate, second only to alcohol. And almost 50 of those admitted were under the age of 30. And 2 of my towns in District 37, Hackensack and Englewood, where I reside, were among the top 5 municipalities with the highest admission rate to a substance abuse program. So I don't need to continue the statistics, but I will tell you all, and I think a lot of you know that I am a funeral director. I have seen firsthand up in Bergen County deaths resulting from prescription drugs leading to that cheap on-the-market drug of heroin. And I will tell you, we cannot do this anymore. It is an epidemic. I know families that have been distraught. Families, as parents said, it could never happen to me, and I know again firsthand because it happened to a very good friend. He died of heroin overdose. And I said there were no telltale signs. The parents didn't even know he was smoking marijuana. Went right to heroin. So these bills certainly increase quality treatment and recovery options. Addiction is part of the mental health system. Addiction is a mental illness. We need to take care and ensure those people that are addicted, just like we do with any other physical ailments.
The central task of the physician is to alleviate the pain and suffering that their patients present to them. It is our obligation to our patients, and I see this often in my practice right here in inner city Trenton. And I see the devastation that these addictions can cause. But I think those who are here and those who are not here but may have an opportunity to listen to what has gone on here this morning and what you'll hear later on this morning, that the central problem is that of addiction. And it has been a problem that has been ignored by our society across the board for decades, whether it be alcohol, whether it be smoking, and now this latest problem that's come to the public attention, that of heroin addiction and abuse. But the problem is addiction. And the fare of society, policymakers, healthcare policymakers, and others, from the federal government right down to the local level, to address the dearth of resources and attention paid to addiction, which is a chronic disease, which probably has genetic components, and which unfortunately involves often things that go unrecognized, like depression and chronic pain. The problem with pain is no one feels it. It is always subjective, but we know people have it. And when people have chronic pain in particular, there are a lot of psychosocial, environmental factors that are involved in it, which makes it so difficult to treat. But treat it, we must. Now, what problems do I see that we have? Someone, and it's been mentioned, you go in with a heart attack, and post-heart attack care is not perfect. We're working on it. But unfortunately, if you go in and have a problem of addiction, you often find yourself leaving a treatment program where you have no place to go to get ongoing follow-up care. And what happens? We know addiction, its hallmark is that you have relapse. People try. They try all the time. Anybody in here who's try to get smoking knows how difficult that is. You'll quit for 3 months and then you'll come back to it. But the policy mechanisms and the response to society must be to recognize that and to continue to go forward with what's needed to get a person's addiction under control. What are the costs that happen when you don't treat a disease of addiction? We see it here. We've heard about it. We've heard about this young man who died. We hear about these deaths in Bergen County. Somebody needs to start looking at the cost of failure to act. And it is going to be important, since we have an insurance-based, an employer-based insurance system here, to make sure that we do something to make that which many people have work for people that have addiction. It can't be, I have a problem and now I have no place to go. We're not providing this care, we're carving it out, we're going to ignore it. You're on your own. That's what people hear today. That's what people hear. And so among the things we need to do, and certainly to increase monitoring, to increase education among in our youth, in our school system, et cetera, we need to make sure our healthcare system works for people who have this problem. That's essential. And that's going to mean doing some regulation of insurance companies. It's going to mean that. Now, it's going to be a fight, I'm going to tell you right now. Those advocates that are here, be prepared, because it's going to be very difficult to move some of this stuff that needs to get done through the legislature. Coverage for Suboxone, making sure people who have to go to methadone clinics that's on the state can get there, and the barriers to cost of going there. I'm going to tour a methadone clinic tomorrow to look at the issues and the things that impact their ability to treat patients. What happens? How does your insurance work for you? What does the network look like? Do you have access to rehab when you need it? Can you go back when you relapse? Those are going to be the central questions, because it is a health problem. It's a health problem.
I really got involved in this issue because of the parents. I want to thank my colleagues for their leadership, but it was the families in my hometown in Hamilton and in Mercer County in the district that I represent. Because of people like Patty and Peggy who said no to silence, who said no to stigma, and said that they wanted to get out there and make sure that we do something. And as one of the assembly sponsors of the Overdose Prevention Act that included the Good Samaritan Law, that was a down payment. But we can't wait till there's an overdose to save lives. And that's what this comprehensive package aims to do, is to start saving lives all the way through this terrible addiction crisis that we have in New Jersey. It says we want to turn these statistics into saving lives, because they're not just numbers. These are our children, these are our relatives, these are our family members. And that's why having the family members here behind us and in front of us here today is so crucial, because it will be difficult getting some of these pieces of legislation passed. But hopefully by moving them all as a package, we can raise up this issue and bring everybody together as a coalition to say every piece here is important, because it is an investment in saving lives and bringing names back to those statistics and realizing we can truly make a difference. So I want to thank my colleagues, I want to thank the families, and I look forward to the fight ahead and being a voice to make sure this legislation moves.
What's happening is an epidemic, and we don't use that term loosely. It really is an epidemic. As also someone who represents Bergen County, I could tell you that addiction has no face. It knows no race, no religion. It affects all of us, from the rich to the poor and everyone in between. My conversations with the county prosecutor have really opened my eyes, and I was advised that nobody really wakes up one morning and says, I'm going to shoot heroin today. It usually starts with prescription drugs. One of the pieces of legislation that I'm sponsoring involves the prescription monitoring program, and I strongly believe that the use of this program will really cause a sharp decline in the abuse of prescription drugs. So I think that this comprehensive package is really the first step in a long battle that we face. I look forward to working with my colleagues, both Democrat and Republican, and really I think that the public supports us. I know the press supports us. And I hope this goes all the way and gets signed into law, because I think we're really doing great things here.
This issue, as a healthcare advocate, we've been talking about this issue for 20 years, for many years, probably longer than that. And the opioid epidemic and the deaths that have been caused recently has really brought it to a head. It's not an issue just in New Jersey, but nationally. And as Assemblyman Conaway said, we're really going to need the advocates and the insurers, the healthcare providers, law enforcement, and certainly the academic areas that need to do more to study the issue of addiction. But we really have to bring all of those facets together to try to address this issue. It's really, we've done issues, talked about locking up medicine, locking up the alcohol, keeping that away, but we really haven't taken many of the simple steps that are efforts to keep drugs out of the hands of kids and other individuals. People have, we've had advances in medicine where we have access to medication that we didn't have before, but we really have to provide that for patients, but also do it in a controlled way to make sure that it's not adding to the issue of addiction. But as Assemblyman Conaway said, Dr. Conaway, the issue of addiction and studying the implications are great, and we need to do everything we can to address that. And the cost is, there is a cost that we're already paying now, both personal cost and a financial cost. We need to look at the insurance issues, look at ways we can make sure that people are getting the attention. Many of the advocates have said on the mental health issues for many, many years that while we're trying to do enforcement and saying people have to go to treatment, we'll say there isn't anything available, or it isn't long enough, or it's not, they'll say, well, we're going to force people to get treatment, but there are many people that are asking for treatment and they can't get it because the services are not out there. So all of these issues together will be able to work together, and we need the advocates and all of the parents and the families to work with us to make sure that we can make progress and make sure that we're addressing the lives and making sure people can be productive and have a happy life. Thank you.